Well, we really wanted to demonstrate our commitment to supporting staff who are experiencing mental ill health issues. And it was a great way for us to have a bit of a framework and a bit of structure to that. And I suppose it was a public commitment, really, to show that we'll always act from the point of view of trying to support a staff member. We will always show compassion and empathy, and it's important that we demonstrated that to all of our staff. I would say for us, one of the first steps was getting the buy-in really from senior management team. Not everybody sees the link between the importance in terms of investing in mental health and in supporting staff. There's also just a fear factor as well, I think, just in terms of people not knowing how to handle it. But we provided a business case to our senior management team, which demonstrated the links in terms of the benefits for the business, and that was a key factor. At the end of the day, people love to see the bottom line. So them understanding the impact that this type of absence has on the business was a great focus point for them. We also tried to bring together really lots of different things that we were doing. I think lots of things sat separately. So whilst we offered an occupational health service and we provided the likes of a Westfield healthcare scheme, we also have a range of other benefits for people in terms of when they're having those difficult moments in their life, and we all have them. So it just really meant that, at a time whenever somebody is having difficulty because a dependent is ill, or if someone unfortunately is terminally ill, we have measures in place there in terms of supporting staff, in terms of paid time off from work. So with those things, we tried to package everything together into a wellbeing strategy, because a lot of things sat separately. And I think it's important to do that so that people can see the full picture. So there are a number of policies and procedures that were all sitting separately, and we brought them all together, and that really helped, I think, show the extent of the support that was really being offered. Mental ill health has such an impact on people's performance at work. You cannot underestimate how much that can influence whether somebody does a good job or a bad job. And we all have bad days, and we all have periods and times in our lives when things don't go well, and whether that's a marriage breakup or whether it's a bereavement, or something more substantial in terms of a diagnosed mental health issue such as schizophrenia or something like that. But sometimes it's the smaller things, and when you intervene quickly with that, that can make all the difference. And I think managers particularly knowing their staff and knowing when they're coming in on a bad day, and actually just being able to say to someone, is everything all right? We can have a day where we snap at somebody, and that's fine, but when you know your staff, you can get in there whenever it matters. And I think that really is the crux of the matter. So having a mental health strategy for us is really just about demonstrating to staff that we are taking this seriously, and by signing up to the Mental Health Charter with the Equality Commission, it shows for us really that we want to play our part, and we want to help destigmatise the sense that people with mental health issues, aren't worth having as employees. Like I say, it's all of those things in life that just put you off kilter now and again, and it's those times when staff just need a wee bit of something extra. It's not that they need some reasonable adjustment that is a permanent fixture. It's temporary things, so these things don't have to last forever. They're just something that you can bring in and wheel back out again at a point in time when somebody's not at their strongest point, and that just makes sense. The Equality Commission have been fabulous in terms of bringing together lots of other employers, I have to say. The learning network that you get from meeting up with other employers who are equally as committed as you, and the learning and the experience that you get from other people really is invaluable, because it's what happens on the ground that really counts. The actual charter itself has been a lot of charters that you come up against, have lots and lots of different promises that last reams and reams reams of pages. It's very focused, and it means that it helps you kind of streamline your processes, and it gives you a focus really in terms of going back to the drawing board, back to your policies and back to your procedures, and screening those in such a way that you know that you are actually giving cognizance really to people with mental health issues in the same way that you do for people with disabilities, or to people that have other current needs, or people who have various different needs within the workplace, so it's been great from that point of view. So we had an employee, and she was off sick for about 10 months in total. She went off very suddenly, and it was very unusual for her. She'd been employed with us for over 10 years. We knew her very well, and this was actually her first ever period of absence. So from the get-go, we knew that there was something not right, and we contacted her immediately. And we opened the lines of communication with her. I think sometimes employers and line managers particularly are afraid to contact staff when they're off with a mental health issue. There's a fear that they're going to add to that stress or that anxiety. But I would say in our experience that couldn't be further from the truth. And leaving someone sitting for any length of time can actually cause more apprehension on their part. The important thing here was someone contacting her who she trusted, because she would not necessarily have spoken to her line manager or to anybody else. But once we opened the lines of communication, we got to meet with her quite soon, off the bat really, probably within about 2 or 3 weeks of her actually going off. And that way we were able to try and explore with her what the reasons were that was causing her to be absent from work. She was very proactive herself. She had already enlisted the help of a counsellor, and we were able to help her with funding around that. We were able also to make contact with Action Mental Health, who offer the Workable Program, and we had experience of that in the past. So we arranged contact with them, and we had those discussions ongoing well before she even returned to work, because it was important for her to know that she was going to have some sort of support once she actually got back to work. But during her length of absence, there were lots of reasonable adjustments that we put into place while she was off. And they're not always the big things that people think about. They're not the putting in a lift or installing ramps and, doing things like that. These were things that were going to make a difference for her. We were lucky we were able to extend her occupational sick pay entitlement, again on a discretionary basis, on the basis that she had never had any absence at all during her 10 years plus service. We have a healthcare scheme that we offer to staff, and included as part of that is counselling. So we funded 10 of her sessions, and she carried on with that. We referred her to our occupational health consultant, and we took their advice in terms of how to progress the case really when she was absent from work. And when she finally got to the stage where she thought she might be ready, we sat down with her and we worked out a return to work plan and how that would actually look. So it was things like a phased return over a 6 to 8 week period, building up from 2 days a week right back up to her 5 again. We looked at her job, we looked at her duties, we looked at the tasks that she felt able to do and the tasks that she didn't feel able to do, and we had transferred those out. So over time they came back to her in terms of her doing the full remit of the job. Probably the biggest thing for her was the Workable Program. She remained on the program for 2 years. She would have met regularly every month with her employment support officer, and I would have dipped in sort of every 6 months, unless there was an issue, and I was kind of the intermediary between herself and her work, if you like. But it was great to have somebody from Action Mental Health who was independent, who could provide a wee bit of perspective at times for her, and they, with our help and obviously with the individual, they created a development plan, and that development plan focused very much on areas that were specific to her and building on her confidence, building on concentration levels, things like that, and they helped support her through that. So when the time came and she decided to exit off the programme, so to speak, it was great for everybody. It was a very brave decision on her part, and for us it was great to see that the investment that we had made had paid off, and we couldn't have done it without Action Mental Health. It's a great great service that is provided there. Well, she's been back to work a number of years. I've seen her confidence increase dramatically. She has never had another period of absence since. And we checked in with her at regular intervals, certainly for the first year or two that she came back. But since then, she has blossomed. She has gone on and done some external qualifications, and she's really at a point now, I think, where she's looking to progress her career. Hopefully, that's with us. But we really have reaped the benefits, and she certainly has come out the other side. And we have been very glad to have been a part in that and been able to support her. In the past, we have run training for managers in terms of stress management, balanced lifestyle, recognising stress indicators, and it has its place. But we're trying an approach where we're just coaching managers on a one-to-one basis as we go and as we come up against people being off sick, because every individual set of circumstances are just so different, and there is no one size fits all. So we're asking managers really to look at the small things that I mentioned, in terms of the number of emails that somebody's coming back to, the types of duties they're coming back to, whether or not they're fit for all of those things, and really just on a kind of on a hand holding basis, we're just being there and letting the managers shadow us until they gain a wee bit of confidence, because again, I think they just are so afraid of whether or not they're going to say the wrong thing, and sometimes it's better just to be straight and ask the questions, rather than be afraid to pussyfoot around them. People would much rather that you did that. Certainly in our experience, that has been the case.